Greetings. Welcome to the podcast of GP Training Game Plan, which is arranged by DMC Club UK. I am congratulating you, both of you first and starting as a host here. And we have two special guests today, and we would like to introduce them first. So here we have two most talented juniors from Dhaka Medical College who have entered GP training recently. One is Dr. Aseer Intisar Saarim, who is from DMC K69, yes, and Dr. Shafinaz Hossain, who is from DMC K73 batch. Okay, I welcome both of you. Okay.
Thank you.
So, as first, it's just a warm-up session. Okay, we'll just want to know how you prepared and how you got entered into the training and all the part, and we'll just chat about that. Okay. So first, you both came to UK through PLAB route.
Yes.
For GMC registrations, right?
Yes, I got GMC through PLAB. Yeah.
And Promi also, right?
Yes, same.
Okay, so Promi, you worked as a trust grade doctor.
Yes.
Right? First.
Yes.
Yes, then you joined as a GP trainee.
Yes.
So first, congratulations again. And
Thank you.
what is the biggest pros and cons of taking a non-training post? Okay, and how did it you add up to NHS environment before training, this GP training as a trust grade doctor? Can you share?
Yes, of course. So I think the first challenging thing as a trust grade doctor was to get the trust grade job. I think that was the
tough.
most challenging thing for me. And I think I applied for around 400 applications over 6 months.
Oh.
Every day I woke up with like around 5 to 6 rejection emails, which were like really, really difficult time for me. And then at around June, I got one interview.
Which year, June? Which year, June?
June 2024. Yeah, so I did that interview, and that was the only one interview that I got, and then I secured the job luckily. And and then I started the trust grade job. So initially, definitely it was difficult because it was a completely different system, and you were moving to a new country. Everything is different, and definitely there's the British accent is also different.
Yes, you don't understand.
Yeah, definitely. It was also a challenge for me. And then but my department was very, very supporting, I would say.
Which department you were in?
So I worked in accident and emergency department in Royal Berkshire Hospital. I really liked that department, and though the people were so supportive, every consultant, every registrar, they just taught me everything by hand. I think that helped me in the GP training because I knew the system by the time I came into the training. I knew how to talk to other specialty, how to deal with different staff members, those all kind of things. So yeah,
that's great to hear.
I think the most challenging thing was to get the job. Other than that, everything came easier.
Was easy, better easy. So you was determined before that you will go to the GP training, or you decided after joining in the NHS Trust about exploring things or other specialties, and then
so from the very beginning, I was determined that I would do something like either accident and emergency or GP. So after starting working in accident and emergency, I really liked that, but the rota and everything was so hectic. It's really, really stressful. Yeah. And I thought that I cannot do it in the long run. So I thought like
you want a more relaxed something.
Yeah. Yeah.
Okay.
And
let's hope so. Let's hope so.
Yeah. I'm hoping that.
Okay. And one thing I want to ask you about that. For non-training, the certificate of readiness to enter specialty training, which is the CREST form, is crucial. Okay. So how did you get it signed here? you certainly get it from here, right? So how did
No,
you get it?
I did my crest form signed from back home. So before
Okay,
coming
okay.
here, I was thinking about next year. I would not wait much because I got my
Yes.
first target job after 400 applications. So I didn't want to go through that again. And they
Mm.
usually do not extend the contract. Like that is not sure that they will going to extend contract next year. So I didn't
Yeah.
want to go through all those uncertainty again. So I was pretty much
Yes.
determined that I will apply for training next year. So that's why I got
Mm.
the crest form signed back home by one of my consultants with whom I worked for 3 months. So that's the
Mm.
criteria for signing the crest forms, that you have to work with the consultant for 3 months
Yes, yes.
within last 3 years. So that I had that.
Mm.
So yeah,
Mm.
that was okay.
I think that was the intelligent thing to do, obviously. And
Yeah.
your quest from got accepted in the first
Yes.
place when you
Yes.
were applying? Yeah,
Yes. It
that's
was.
very good.
Yeah. Yeah.
Okay, and you were in busy schedule, right? A full-time trust-grade job.
Yeah. It was.
Yes, you have your crest form signed, but
Yeah.
you joined here as the new. So how did you manage the time and stress for applying GP training? Because you are already in your job full-time, right?
Yes. Yes. It was.
So how did you
Um.
manage the time,
I
stress,
would say
and
it was
preparations?
really a challenging time because this was my first time coming to UK. Apart from that lab time, it was like I just stayed
Mhm.
there for 5.5 months. But apart from that, this was my first time coming here, adapting to everything. And then on top of that, I was applying for GP training, started studying, and I could not manage.
When did you start studying?
I think I started studying in October. Before
Yeah.
that, I was like getting to know what are the resources I need to do, how the exam ran, and all those things. But I started like studying seriously in October. So yeah, it was busy to, it was very challenging to take the time and do the study while doing all those hectic rotas in emergency. So I managed somehow. Yeah, but it was tough. Yeah.
When did you get your GMC registration?
I got my GMC in January 2024.
Okay, that was
Yeah.
quick. You didn't waste
Yes,
that
I
much
was
time. Yeah.
lucky. I think I was lucky.
Yeah,
That's all
yeah,
I'll say.
yeah. That was very kind of you.
Yeah.
Okay, so we'll come to about your preparations about the
Yeah.
MSRA later.
Mhm,
Let's
mhm.
get to our other guest first.
Yes.
Okay,
Yeah.
so Aseer,
Assalamu alaikum. Yeah.
walaikum assalam. Okay, you are one of my favorite juniors from GMC. So tell me, you
Thank you.
directly
Privileged.
entered. Okay, okay, you directly entered this MSRA route
Yeah.
and you directly entered into the GP training. As I know that you didn't you work as a trust gate doctor. Okay, so you tell us why you choose the GP practice or MSRA exam, and I think outside the UK, just sitting for this exam is a huge hurdle. Okay, so tell me about your preparations. Why did you choose first? Why?
Well, I'll
Is it
just address a small question of yours. The thing is, yeah,
okay?
so outside, applying from outside, you are saying that it's a huge hurdle. I would slightly disagree because I would say that I have found it easier than Shafinaz or Promi. Which
Why?
one?
Why?
Oh, well, anyway, sorry. Which name do you prefer,
You can
actually?
call me Promi. That's fine.
Okay, Promi.
From me, yeah,
Sorry.
Yeah.
fine.
Okay.
Yeah.
So I think mine was easier than Promi because like in Bangladesh, we can manage more time to study. We can even study at work,
That's yeah,
which
yeah,
is
that's
very difficult to manage here. I mean,
Actually.
especially working in a busy place like the A&E.
new environment actually.
Well, yeah, obviously, but it's busy as well. So, those who work in Bangladesh, they would understand. Those who have the same experiences in working in both countries. Anyway, sorry, I'm making it
Oh,
unnecessarily long. So,
no,
the
it's
thing is,
okay. You can share
regarding the,
whatever you want. Yeah.
so I would say yeah, there was one challenge. So the SJT part. I believe that anyone who is watching by this time knows that the exam has two halves. One is like decision making, I mean
Yes.
critical reasoning sort of thing. So that's called SJT or professional dilemma, and there is the clinical one. So I would say
Mm,
that preparing for the clinical one is easier being outside the UK
mm.
because I'm not sure
Clinical
how the
knowledge is
candidates
universal. Yeah,
candidates
yeah.
here. Yeah, exactly. But the professional dilemma or the SJT part, I found it to be difficult. And well, I had been in touch with at least, I'd say, 20 people who have appeared at the MSRA from from overseas. So all
Yeah.
of them have found it's difficult to cross the SJT hurdle. So yeah, it was on one side it was difficult, but the other side we were privileged as well. So why I chose the GP training? To be
Yes.
honest, I like to be honest and transparent.
Yes.
I
I
am
fully
a sort of
appreciate.
person. So I graduated in 2017. So it has been a long time since I came here, and I'm actually
Mm.
quite senior to Promi here. So I would not say that I was a focused sort of person. So I sat for PLAB in 2022 and got my
Yeah, I
GMC in
know.
2023, and I did not apply for as many jobs as Promi did. So I found it inherently difficult for to write stuff like they make preparing for the
Yeah.
job application stuff.
Yeah. Do a lot
So
of documentations.
I was actually doing I was appearing at the MRCP. So I
Mhm.
completed two parts in 2023, but I could not sit for uh, the paces for 5 or 6 times,
Congratulations
five
on
times.
that.
So 5 times. So thank you very much. Well, at this point it feels irrelevant, but thanks anyway.
No, no,
So
it's great.
okay.
Great.
So when in I'd say I had my MRCP paces in November. So by that time, I came to know that actually it's possible to apply for training directly. So I explored what are the options I had. So I saw that every training requires a certain portfolio except the GP and psychiatry.
Did-
So I
Yeah.
thought, why not? I can apply it. I don't have to join right away after I apply. So I took both of them on my table, I'd say. And for
Yeah.
IMG, I found that there are multiple point scoring systems were there. So I would score some point for MRCP only, but I didn't have anything else. So my
Anything
portfolio
else?
would look very skewed, and I thought that it's better to just sit for the exam and try my luck. So that's why I
Yeah.
applied for actually with emergency, because I have experience in emergency mostly like 3 to 4 years, I would say, altogether. So
Mm.
I applied for emergency, ACCS, and GP and psychiatry. So GP, I would say I had a certain leaning. I would say, yeah, leaning is the right word in this case. So I
Mm.
had, because I believe as a GP I have to encounter. I have to deal with multiple specialties, patients with multiple sort of problems. So like jack of all trades sort of thing. So I did like it. So I did have a sort of, I would say, preference towards GP as well. So basically, that was not the sole reason, I would say. That was not the main reason, I would say. Basically, as I was
To enter
overseas and
UK.
yeah, I
Yes.
wanted to come to the
Enter.
UK and learn the NHS system. So that's why it was the main driver was the ease of entry, I would say. If
Yeah,
you
that has become very tough nowadays to enter actually. I know about that.
no,
So
actually,
if
the
you have
ease
known
itself,
that, yeah,
no, I mean, if you allow me to elaborate, by ease, I am not saying that it's easy. Well, I'm trying to say that if there are many things which are not under your control in the others.
yes,
So, Promi here, who applied for 400
yes,
applications, and I don't know if I'd be correct to say that, but I would still like to go ahead with it. So maybe in the out of the 400s, 300, in the 300s she did not stand a chance at all, because they would
yes,
recruit amongst their attaches from amongst, or maybe in some cases they already have some candidates shortlisted even before the advert
mhm,
was published. I don't know. I mean, I have heard these things. I don't know for sure, but so there were too many uncertainties. But
yes,
in the GP training or the psychiatry for through MSRA, this thing is in your control, and definitely Almighty's control as well, but that's universal.
mm,
You so but I would say, so I at that time in November I had my paces. So when I found out that the visa is being challenging, many people are struggling to get a visa, and I started late the application of visa itself. So I was thinking that it's better if I start another side hustle. So basically, that's why I applied. And when it was, I mean, when it was confirmed that I'm not going to get the chance to sit for the paces, then I just migrated. So shifted my focus instantly without wasting any
So,
time.
if you have known about this MSRA exam and this GP training before, you would have not appeared in the MRCP exams? What is
Uh,
the plan actually? Do you have
so
any
sorry,
idea?
actually, yeah. So I started initially when I started speaking, I was thinking about elaborating more on that aspect, but I actually drifted apart. The thing is, yeah, I would not say I have like I'm very much interested in medicine or anything. So when I graduated, I took the decision in this way. So not surgery, not gynae. So what's left? It's medicine basically. So
Basically,
not
medicine.
pediatrics, not psychiatry. Why not pediatrics? Because I find it really inherently difficult to communicate with the pediatric patient. Not psychiatry. I
Yes.
think I just lack what it takes to be a psychiatrist. That's why my choice was by a method of exclusion. So that's why I was appearing for MRCP, because I thought I had no other option left. Not that I am I am very much into medicine. It's not that. So that's why when I came to know that a pathway like this exists,
Exists, yeah.
yeah, exactly. I didn't know before that. So actually, I did know. So I also tried to apply in the last round, but I did not know that I'd have to ask for the BMGC registration of the consultant who is signing my CREST form. So I could not secure that. I got a CREST form reading,
Okay.
but I did not. So that at that time I did not could not apply because I did not have that.
Because
So
that was expired, right? Yeah.
yeah, so
Yes.
so that's why I applied in the next round. So what
Okay.
the thing that I would like to emphasize from all that
Mhm.
I've said from here. So basically, I've got the feeling that people still are not aware of such a pathway which exists. So
Yeah, I think that
that's
will
why
be
it took
helpful
some
for
time.
many of us because
Thank
you
you very
don't
much.
need any other things. Just you have to apply. So many are trying to enter here now, right? Because it's tough. It's getting tough nowadays to secure a job to enter UK. So it will be very beneficial. And then tell us about your preparations, your resources, and all. And be very specific about that. Okay, how did you prepare? Which materials you used, and how many times you revise and all. You are very good at this, so give us a guideline.
So if it's okay, I would like to listen first.
Okay.
Oh, okay. That's great.
Right. So for the exam, so there, yeah, as Maya said, that there's two parts of the exam. One is clinical problem solving, and other one is situational judgmental test. So for
Mm.
CPS, that is clinical problems. So I used three resources. Those are because I used those three because I found that pretty concise. So as I didn't have much time, so I wanted some concise resources. So I used MCQ Bank, I used Samsung,
Yes.
and yeah, and eMedica. So all the three resources I used for clinical problem solving. I found the
Okay.
exam questions were pretty much similar to the Samsung mocks because
Samsung
like
Max.
I would not say that you will get common questions from the Samsung mocks, but the question pattern is completely similar. I found that. That's what I felt. And
Okay.
yeah, but
And
those
they are accurate. They are accurate. The
I would say, yeah,
materials.
I would say those materials were pretty much accurate. And the good thing about those was there just you go through solving the questions and then read the explanations, but it's not very huge. I also had a subscription for Path Medicine MSRA, but I found that so huge. I thought like I would not be able to finish it in
Okay.
time.
Samsung is more concise than PassMed.
Samsung, MCQ Bank, and eMedica, all three are concise and PathMed. PathMed is like huge,
Okay.
hugely
And
huge, I would
how
say.
many mocks did you take? At the last
I
or
think
in the middle? How?
no, I started doing mocks from the very beginning because I found the clinical parts is more of like your MBBS knowledge. They don't want you to know the specialist treatments. It's all the MBBS knowledge. So I think like I thought solving the mocks from the beginning. In the meantime, solving the questions from MCQ Bank and eMedica topic wise, like I do cardiology and then next day I'll do respiratory like that. Yeah, so I think I completed all the mocks in Samsung. I think I did that twice, but apart from that,
How many
all
mocks were there in Samsung?
I cannot remember exactly, but I think around 18 to 20, if I'm not wrong, but I cannot remember exactly.
Yes, yes, no
Yeah,
problem.
yeah. And for MCQ Bank and eMedica, I did the questions only once, but I made some hand notes. Say
Yeah.
I'm reading a topic and then I find that I don't know this, but I didn't know this. In that case, I put a small note in my handbook. So I
Mm.
did revise that at the end, just a week before the exam.
Okay, and you revise the Samsung or just once? You go through the material just once or revise how we
So
should plan?
I went through the materials only once. I did the Samsung
Mm.
mocks twice because I thought
Okay.
I have also like read lots of comments and posts in the Facebook that
Yes,
Samsung mock
yes.
is pretty much similar. So that's why I did that because I didn't have much time. So I have to do whatever I can. So yeah,
Yeah.
but other than that, MCQ Bank and eMedica only did once. But I revised my hand
Mm.
notes. So
Mm.
those were there are lots of things, and I feel like I have got some questions from my handwritten notes, so that I was lucky. I'm really really lucky in this
Okay,
as
yeah,
well.
that was
Yeah,
really great. Yeah.
yeah, and yeah, that was my CPS, so clinical problem preparation, and then for situational judgment of tests, that's we call SJT. That was
Yeah.
a very very boring to do study. Like I was solving like two questions and 1 hour has been gone. So it was like very difficult. But I used two resources. One is Oxford Handbook for HAT
Yeah.
and other one is foundation year papers. So you can get both on like you just Google it and you can get it.
Mm.
But I bought the Oxford Handbook hard copy because I found that
Mm.
I need to study
You
like very
prefer
yeah,
hard
yeah,
copy, yeah.
yeah, yeah. But foundation year paper you can find it on Google, and Oxford Handbook you can just order it on Amazon or any of the
Mm.
sites. Yeah, I only used these two resources. I didn't have any time to solve SJT for many of the question banks, but people do that. But I didn't have time, so I don't have any idea how are the SJT questions in those question banks. So yeah,
You about Samsung, MCQ Bank, and eMedica, there is no SGD questions.
yeah, SJT parts are also included. When you take the subscription, you have get
Yeah. So
two.
you practiced
Yeah,
also from them.
no, I didn't have time to go through the
So you
SJT
just go through
questions.
the
Yeah,
Oxford Handbook. Yeah.
Oxford Handbook and Foundation Year papers. That's all.
Okay. So you first go through the clinical part and then for the SGT.
I would say I did both side by side.
Both.
Say I'm
Yeah.
studying,
Both
yeah,
side by
I'm
side.
studying 2 hours in a day. So I'm doing one clinical 1 hour and then doing SJT for an hour. So I did both side
It
by
would be
side.
good, right? And
That's how,
about
yeah.
the mocks, how should one score at the beginning or at the end, and how did you develop your marks in mocks so that you can be confident enough that I will be securing some good marks in the exam?
Okay, so that's a tricky question. I'll
Yeah,
be honest that when I sat for the exam, I didn't have much hope that I will secure a place. That's the
yeah.
honest answer because in the meantime I
Everyone,
was
everyone.
yeah yeah because I didn't have I before this is the first exam I did without like properly revising because I do every exams with like revising lots of times. My friends know that, yeah. But when I went there to do the exam without revising, I was feeling like, yeah, no, I'm not going to make it. But somehow I did that. Um, I think initially when I started doing the mocks, I was getting around 60 to 70% marks, but I was not really sure whether I will not be able to improve it. And by the time my preparation was finished, what happened? Like it felt like I know the questions because I have done the mocks already once. So it didn't make any sense to be honest. Although I'm making like 80%, 90% marks, but it's because you know the questions, you have done it once. So was like, I don't know whether it helped me doing it twice or it's just the pattern was same, so I found it easy. I don't know.
So when you appeared at the same mock second time, you found it easy
Yes,
because you
yes,
already know the questions.
yes, I knew the
So you
questions.
go
Yeah,
through the same questions
yeah,
at the
yeah.
box. But it is pretty good also at the first attempt. You have got 60 to 70% marks. So I think that
Yeah,
was also
I would
good.
say
Yeah.
I would say just because I did MBBS, like it was not very long ago. I think the knowledge was still fresh. Because I feel like it's just the MBBS
Yeah, it
knowledge.
was
That's
good,
all.
certainly,
Yeah.
I think. Yeah.
And also, I did
It-
my PLAB in 2023, so that was also not very long ago. So the PLAB
I think
knowledge,
a
I think,
lot
also
of
helped
questions
me.
come from
Yes,
that
yes,
knowledge also.
true. Yeah,
So
that's all.
you suggest that if you go for the exams after passing the uh, mm, PLAB exam, then it will be helpful because the knowledge will be fresh, right?
I think so. I think that's what I
Yeah,
found because PLAB exam is also something like you have to know every specialty. It's not like only medicine or only general surgery. You have to know
yeah.
everything. MSI is also you have to know IENT, everything. So I think
Mm,
like yeah, you will find it easier. So if you do MRCP, you might find
mm,
medicine part easier, but you
mm.
have to work for general surgery, obs gynae, IENT, everything. But yeah, PLAB was like you have to know all the basic things for all the specialties, and I felt MSI is also like that. So yeah.
Okay, that's great. Okay, coming back to you, Aseer. Promi has mentioned that she just passed the PLAB exam, then sit for it, and she has got an advantage because her knowledge was fresh. But you told that you have passed PLAB back in 2022, so there is a gap. So tell me about your preparation actually, how much time you get and what the materials you used and all, because Promi has given us a very good feedback about this. Okay?
Well, before I start, I'd like to take this opportunity to express my appreciation at Promi, like how organized and detailed she was,
Yes.
and I would say precise and concise as well when describing her journey. I would say it's well, I'm out of words to be honest, but it
Thank
was
you.
really good.
Thank you.
Yes, she is
Okay,
very precise
so
and she
and
knows what to study.
yeah,
Yeah.
and before I start, I would like to ask you one question, if it's okay. So, uh,
Yeah, yeah.
to her, before I continue. So, would you
Mm.
mind ranking the resources that you used?
Yes, I would say MCQ Bank is the number one because you have to do number of at least you have to do number of topics. So MCQ Bank is number one, and number two is Samsung, and I would say number three is Emedica. Past medicine, I don't want to rate it to be honest because I found it so huge. I didn't go through it. I had the subscription, but I didn't use it.
Well, okay, thank you. So now
Yeah.
if I start, so I would say
Mm.
there is a stark contrast between my preparation and Promise preparation. So that's a key take-home message to anyone who is listening, that there can be multiple approaches. There is no right answer to
Obviously,
these questions,
obviously, obviously.
especially something like MSRA. There are certain sometimes maybe there is no right answer. Even examiners don't know what is the right answer for SJT maybe. So anyway, enough humor, I'd say. So the thing is, I personally use past medicine, and I completely agree with Promi regarding what the negative
Yeah.
aspects of past medicine which she highlighted. But I did pass medicine anyway because I went. I sat for MRCP part one and part two, and I would say one thing in past medicine which trumps everything. I would say every other resource is the user interface. Once you are familiarized with it, so it's something like it was just I was very familiar with it. So past medicine, the revision options, the functions that you can use, it makes revision very easy. So I would say when I was completing questions, I would do 100 per day. So that's something I could manage because I was in Bangladesh. I can't imagine. So I would like to take another opportunity to comment from me that studying 2 hours every day, working in the emergency I can't even imagine how difficult it might have been for you. So again,
Yeah, it was
congratulations.
tough. I would say it was tough, and there was days like I was just crying in the study days because I want to
No,
study.
and
I
Well,
I
have to go to
also think
work.
that you have a
so
very good basic knowledge also,
those
because
days are
No,
without
no,
it
over.
you
no,
can't.
no.
Those
Yeah,
I would not say
only
that.
only
It's the
rosy
same for
rosy
all.
days and sunshine up ahead, except for the weather. So okay, coming back to the point. So I was familiar with the past medicine. So what I found was for medicine part itself, I actually needed to tone down myself, because if you overthink in a question of, like, especially after appearing at the MRCP part 2, I used to my focus was shifted, I would say. So I would look for clues in every word, but for past medicine, this is not the correct approach. So sorry for the MSRA, this is not the correct approach. So I needed to tone down myself, and but I didn't have to read much, so I only did the questions of the medicine part. So that's half done for the clinical, I would say. So medicine comprises of at least 50, or nearly 50%, I would say. And but in the other aspects, like especially in gynae, that's something I want to tell everyone. So by the time I finished past medicine, I could not revise everything. There
okay.
may some familial personal
How much
reasons
time you
were there.
take to complete the past medicine?
I'm not sure, to be honest, because my the way I study is a bit different. So I actually also did organize my time. I'm coming to that a bit later.
Mhm.
But I started in November, uh, right after my exam basis was on 15th.
Mhm.
So I'm not sure when was the last date of. I can't even remember. So but my exam was in January 13th, on January 13th. So less than 2 months. But uh, well, I'm not sure how much time I used. So there were a
And the
lot of things.
AGT
My
part?
brother's marriage and things. I'm coming to that. If we can, if we do have time, I'll
Yeah,
try
yeah,
to.
both have
Yeah,
time.
okay. Okay. So what I did, why I chose past medicine, because past medicine had multiple functions. So in past medicine there were notes which I studied in my free time, and for medicine I didn't have to read it as much. I just skimmed through. But for the others, I studied first the note part, and then I went for questions. So what I used to do when I was working in the emergency, so I was not busy all the time. Patients used to come, so I would give a decision, and I would get a lot of windows lasting for like 5 minutes. So that's enough time to do three questions, I would say, for clinical, for a system that you know, and enough time to do two if the system itself you don't know, like for me, obs and gynae or pediatrics. So I would like to, when I was working, I would do questions, and when I was free, in my free time, I would read the notes. And in the free and even sometimes, like when I'm going out, I have even shorter breaks, like maybe less than 1 minute. Sorry, excuse me. I would use the knowledge tutor function. So past medicine I used because the user interface was familiar to me, and I heard about MCQ Bank and Emedica, but I actually did not have time to. And Emedica, MCQ Bank, probably you cannot purchase from Bangladesh. You need to do some engineering, financial engineering with someone, let's say, because someone had to buy it from outside. So I was
Mm.
considering it, but what I normally, how I prepare, I try to stop studying anything new by at least with 1 week at hand, and then I try to revise. But in that case, my brother's wedding was there, so some family issues were there, not negative issues like commitments. My brother's wedding, so these were the things. So I could not focus as much. So why I'm raising this up, because in my exam, I in the gynae, so it's really obvious. Anyone who has sat for pleb knows that the contraception, there is only one table of contraception, and people, that's very important. That's basically, you need to know every letter of that. But so I made multiple mistakes, not just one, multiple, from that sole table. So that's something I'm really not proud of. making the mistakes, but I'm raising this issue because I studied past medicine. There were so many things that I could not assign enough importance on the important topics, which I would not make, which mistake I would not make probably if I went for another resource. But
a little interruption, I think. I
okay.
went through the PassMate once, and you told that there was subject-wise, but in PassMate there was not subject-wise. I think in the clinical part there was 3,000 plus questions, and the SGT
Yeah,
part there are 400 plus questions. So these are
less
not
than
like
400 alone.
system-wise. Yes, but
Yeah,
they
no,
are
the
not
clinical,
system-wise.
no,
You have
clinical
this
one.
scattered questions, like one question you get
By
from
system,
gynae, and the
I'm
second
saying, the by system I'm saying gynae. I'm not sure, Apu, if you are familiar with all the functions, but
yeah.
actually in past medicine, especially when you are revising, you can arrange questions by topic. So all the questions with
Oh,
ACE
that would be
inhibitor.
great because I didn't
Yeah,
know that.
yeah, that's
So
the
I
thing.
can,
I have been
yeah.
studying past medicine for 1 year, so I am familiar with every function there is. There is a
So
lot of
at
things you
first
can do.
you can categorize things, you can categorize questions.
You can categorize like the questions from gynae that you can do. And
Yes,
when
and
you
the
are
questions from
revising,
medicine. Yeah.
when so basically system wise you can categorize when you are studying. So what I used to do
Oh,
is study
okay.
all
That I
the
didn't know.
let's say for all the notes of gynae I completed. Then I went for questions from gynae, and then
Okay.
knowledge tutor from gynae as well. So knowledge tutor is basically like I mean, what is this, what is that, what is this, what is that. So that's very good knowledge refresher. So and you can do it even let's say you are even traveling, and you even
Mm.
you are gossiping with friends in a tea stall. You
Mm.
can do that even at that time. I mean, it requires so less attention, I mean, so less time span, so short.
So you just solved the questions from the gynae part, but you
No, I'm just
elaborately
saying,
read the
I'm
notes
gynae, I'm
from
bringing
medicine and
gynae
surgery.
as an example, and
Yes.
I'm bringing this up as an example because I did not do well in gynae. That's why, but I
Okay.
should have
So
shouldn't have taken.
is it good to study first the notes and then go through the questions,
So
right?
if someone is using past medicine, someone
Yes.
who has time to get to know with it. So for my
Hmm.
MRCP part 2, I studied two resources, but my revision material was past medicine because I from past test I used to write down everything in the past medicine. There is a notes section as well, personal notes. So basically, I would say I am different from Promi in such a way that I did not use paper much. So my notes were like on devices because I used to travel, so it's
Hmm.
difficult to carry books
Yes.
or notebooks. So my preparation was digital, so device based. So I used to make
Okay.
notes there. So if someone is studying past medicine and once you have to finish it, go through the excruciatingly long preparation phase, but
Yes.
after you finish it once, you can utilize the multiple functions, and I mean the revision can be very useful, but you need to manage your time well because I could not. And my in my clinical revision, I could not cover all the important ones, important topics. So I tried to know everything. Then I missed a few important bits. So like antibiotic. So in the pediatrics, there are certain situations
Hmm.
when you should give antibiotic, when you should not, what day is
Yes.
right or left, many things. So
Hmm.
so center criteria. These are the things where
Hmm.
I missed questions, which I would say is critical not to miss, but I did miss. So, but
So,
I did well in the medicine part. So I think I made only one mistake from medicine. Otherwise, I did not make. I think I'm not sure.
okay. And
But
you go through the notes first, then you solve the questions.
notes,
It is a better
questions,
approach.
notes, questions,
Okay.
then revision. So that's
And you didn't appear in any mocks like promises that
the past medicine
she's
mock. But
there. Yeah.
one thing I would like to
Yeah.
emphasize that past medicine is not representative of the exam itself. No, it's not
Okay.
regarding clinical. So the questions are unnecessarily long there, and uh,
Took a
that's pointless.
lot much time.
So
Okay.
and regarding SJT, so
Mm.
I made this mistake which many people makes. I would say
Mm.
many people did. So in
Mm.
the clinical there were only 3,000 ish questions, and clinical there were 350 ish questions.
Yes.
So the SJT in the SJT.
Mm.
So naturally did not assign as much importance as I should have. So I would say after completing past medicine, I learned nothing. I would say not much. I mean,
Okay.
knowledge-wise, I did not learn much. And so that's one thing I can tell you, that past medicine is not the resource you should use for SJT. That I can tell
Okay.
you.
Okay.
So I
That's
have
a
heard
very
about
good
Oxford. I
thing.
have heard about Oxford, the SJT book,
Mm.
but by the time I got it in my hand, it was just like 1 week prior to the exam.
Mm.
So I didn't want to go through anything new by that time. So I just tried
You
to
should have
revise.
gone, you think?
Well, I have not studied it even once, so it's not appropriate to comment without
Yes,
personal
but both
experience.
of
But
you are telling,
from
so
what
I
Promise
think
said,
that's a very good.
I would recommend
Yeah,
this to
definitely
everyone.
recommend that you should go through that. Yeah.
Yeah.
And how was your mock actually? How many? Promi said very precisely that 8 to 20. So she gave us a
So in my case, so
calculations.
past medicine,
Yeah.
I would say that the questions. So give me 2 minutes, so I'll drift off the topic and come back. So
Mm,
that's called circumstantiality. It's important for the exam.
mm, mm.
Anyone who knows circumstantiality. So when you drift apart from a topic and come back, it's called circumstantiality, and if you don't,
Okay.
it's called tangentiality. It's important for psychiatry, thought form.
Mm.
Someone who studies, just Google this, you'll get the idea, and it will help you in the exam. Coming back, so what I was trying to say was, um, sorry, I just lost focus.
Mock. I got the box. I got no problem. I got the mocks.
Yeah, so for past medicine, I was familiar with it. So that's what I was trying to say, that the regarding every resource. So eMedica, what Promi said, that eMedica is not as good. Past medicine has got some limitations as well. So these notes are not updated. So, but
Okay.
MCQ Bank is probably updated, and it represents the exam in a better way, because the exam is evolving as well. So, past medicine had this loophole that they were not updating the exam. So, what happened was, many questions were common from my MRCP part 1 and part 2 in the medicine.
Mm.
So I was scoring like very good, above 80 in my first attempt in medicine. I can't actually remember the percentage, but in the others, I was scoring around 70 in clinical, I would say. In
Okay.
the first go, and in the second go, actually, in past medicine, once you answer all the questions, you cannot check the percentage. You can go through the questions, but the percentage gets
Mm.
lost. So I don't know.
Yes.
But well, so that's 70-ish. But as the exam itself, like the resource itself, is not representative of the exam, I would
Mm.
say that it's a false picture for me. Uh,
Okay.
so I would like to go with Promi. Whatever Promi said, that's the accurate picture. So if someone is going through any resource and getting those percentages, I think you are uh, at the right pace and in the
Yes,
right
because
place
you
at the right
have
time.
the MRCP two parts and you have the knowledge from there. So if
And
anyone is
some
preparing
questions
for
were
GP
like
training,
repetitive. So even
repetitive,
reading
yeah.
2 lines, I knew the answer. But that was that.
Okay.
In the exam,
So
it
for
doesn't work
I
like
think
that.
for Promi, it was for the first time she was studying for the GP training or MSRA exam. So that was ideal one. Okay. Then okay, the preparation part ends here, and we will now focus on the GP training. Okay. So coming directly into a UK training post is a steep curve. Okay. And what is the biggest, I think, I want to say the challenge or shock part in the learning curve in the first few months of GP training, starting as the ST1, both clinically and culturally, how you adapt it? Because you haven't entered into the system first, you come through the training post directly. So entering directly into the GP
So the
training here,
question
how you
is
adapt?
directed at me, I'm guessing. Sorry.
Yes, 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 yes.
Sorry. Okay.
Hmm.
So it was adaptation. It was difficult because I had to adapt with, like, I brought my
Hmm.
family with me. So my family had
Hmm.
to adapt with a new culture, new
Hmm.
place,
Hmm.
and the training itself. And even before every training or any job, you have to go through the onboarding process, the pre-employment, which are like very, very I cannot find the right word, but it's very,
Hectic.
I would say, it felt, yeah, so something like that. So for someone who doesn't
Mm,
know how the UK
mm,
system operates, so I
mm,
found it really difficult. And so I struggled with the onboarding process itself, and I actually did join a bit late. I couldn't join in time. And then that's one thing. So the family, the system, and then the third thing is the specialty. So
mm,
I'm placed in old age psychiatry now. So psychiatry itself is very different from
mm,
Bangladesh, how it's practiced, I
mm,
feel, from the very little experience that I had in my internship and
mm,
student life.
mm,
So that was another thing. So it was really difficult. But what's very important for anyone who would like to follow my footsteps to know is
mm,
that there is a system to offer you support. And but you will have to seek the support. If you seek the support, you
mm,
will get it. So I joined late. So
mm,
everyone told me that if you came as a trust grade, they would keep you supernumerary for some time. So by supernumerary, it means you are not integrated into the rota itself. So you will come and
mm.
you will shadow
You'll
someone.
get some spare time, yeah.
Yeah, so everyone say discouraged. I was discouraged by many that they would keep you supernumerary if you came as a trust grade, but as a trainee they will not do that. But I sought that support and I got that support, to be honest.
That's great.
So
That's
and
great.
it was like only 3 days they managed it. So I said that I need shadowing. I can't do it basically. But that's something
Since
that
I'm
you are
new.
putting. Yeah, so you are putting yourself in a risk as well, because you are, if you are asking for a support and you are given, you will have to show that you are
Mm,
utilizing that support. So
mm,
that was difficult because I had to like
mm,
prove to many people that I'm trying my best, I'm making progress. So the journey was hard. I had to study. Let's say I saw 2 cases only in one day. That's not less, I would say. So if someone who works in the UK knows that seeing 2 patients in a day is in psychiatry is uh, not a lot but not
ideal.
less. So yeah, that's ideal, the right word, optimal. So what I had to do is come back, and so I used to take notes. Whatever the one who I was shadowing was saying, I took notes, and I when I came back, I had to go through that. So every day I was like working for 10 hours, 2 hours extra
Mm,
after coming home, while
mm.
managing my family, my wife and child who came with me as well. So it's difficult, but I would say, like, we the Bangladeshis are like cockroaches. uh, by cockroach I mean we have a very high
That's a good
adaptability.
thing. Yeah.
Yeah,
Yeah.
yeah. So we can adapt, and
We have faced worse.
we did
Right?
have, like,
We have
wherever
faced
in
worse.
Bangladesh
Yeah.
you have worked,
Yeah. You
workload
have
is
faced
something.
worse.
Yeah, exactly. So workload is something. Yeah, yeah. So workload is something that we are not scared about. So I'd say what I did when I came, I joined late. I let my everyone in my ward know that I'm new. I don't know a lot
Mm,
of things, so I'll need support. So that puts you at risks with something. So you don't get on well with your colleagues. Maybe you may not be as lucky to get colleagues who are supportive. Everyone
chance.
of
Yeah.
who. So in the ward where I was a GPST one, and there were three F1s and a PA. That's it. So and the consultants, so consultants don't stay in the ward all the time. So I was the senior most, and I was asking the F1s what to do. And so not everyone is going to like it, that why
Yes.
someone
Yes.
senior
Yeah.
senior is asking me for everything.
How to do
So
it.
and the thing is, I was not as fluent in English as I am now when I came. So sometimes I'm trying to tell him that this is not that I. So I'll just give you one example. So I came, they told me to go and review a patient for with that.
Mm,
I,
mm,
the question that struck my mind and made me like stand still was, what does review mean? I mean, do I have to view once then review, or someone has seen, I'll have to go through the notes? And so I couldn't even. So they were like very looking at me with an awestruck face, that why does this guy not know what review means? Do you not know to review a patient? When have you passed? So basically these sort of things. But review, I mean, the thing which we mean by see. So seeing a patient and reviewing a patient is the same thing. I didn't know that. And
Oh,
that's
okay.
something that those are the weirdest of, I mean, say like weirdest of encounters which I had to go through, and I could navigate through because, well, I'd say that not all the colleagues were supportive, but most of them were, and their seniors. When I told them, like, I got the chance and they were free time, I spoke to the consultant, and there is a, so for a trainee, I'm coming to that. Maybe Promi can elaborate a better. Uh,
Yeah.
so there is a supporting structure. So every trainee has a clinical supervisor and an educational supervisor, and also training program directors who are assigned to oversee you. So you can seek support to any one of them. But normally it's recommended that you go through your clinical supervisor, and those, they are responsible for any sort of failure that you, or failure or anything or incident, whatever you go through, they are responsible for it as well. So went to my clinical supervisor and said everything. I did not hold back. I did not try to hide my weaknesses, and I said
You
that
ask
I think,
questions.
yeah, I not only that, I also exposed my vulnerabilities. So I said that I have not done psychiatry ever, so it's not safe to for me to independently see a patient in psychiatry. I can do manage with the physical health stuff, but for that I can't. So that's
So
something
you
which
started with
is
psychiatry
old age
rotation?
psychiatry. Yes, I'm still in old age psychiatry. My rotation is not finished yet.
Okay.
So,
Okay.
but
So you
well,
have done the shadow training. I think it would be
yes.
easier for you, right?
So
Definitely.
I'm trying to say that those who are afraid to come, like, don't join training directly. You will, yes, you will be putting yourself through a hell of a workload, I would say.
Yes.
But it's possible to navigate through that, and you have a
Mm,
lot of support to navigate through that. In a trust grade job, you also do have a ES and a CS, like educational
mm,
supervisor, clinical supervisor, but they are not
mm,
as responsible for you and to ensure your progress in a
mm.
trust grade job as they are in a training job. So that's why, when if you can escalate your needs to the right to the supporting system, you can get that. And using that, you can actually, I would say that by that, I feel pretty confident that within the next 2 months I would be like in pace, at least, if not like excelling in my job, I would say at least I would do
Pretty
the
good.
more
You'll be
than the
pretty
bare
good.
minimum, at least the average. Yeah.
Yes. Yeah. So
So
don't lose hope.
I'm
I think
sorry,
we
sorry
should
for
encourage
such a
people
long answer.
coming.
I'm
No,
sorry
no,
for
it's
such a
okay.
long answer,
No, no, no,
but
no.
I try.
So we would
I hope it
encourage
helps.
everyone, I think, through this route because many people in our country, in others' country, are trying to get into UK. So I think that's a very good pathway for this. So we are going to Promi now, okay? So Promi, uh, Asid elaborately told about his challenges. So you are a target first, then you go through the training, and what I heard that in GP training you rotate through hospital and GP post, right? And could you tell me the differences between your hospital rotations and GP practice rotations, if you have attended any GP practice rotations, and how you adapted your approach to it?
Right. So I am still in hospital rotation. I haven't yet started my GP rotation. My GP rotation will start in February. So to answer your question, I'll be able to answer more in February. But what I've heard that um, GP is a bit different. You have to do lots of admin works. That is not the same in hospital. And in hospital rotations, you will get a proper break, at least maybe for half an hour. But in GP rotation, I've heard from my senior colleagues or other colleagues who are doing the GP rotations that uh, during the break time, during the lunch time, they have to go through the test results, different referral letters. So they have to do those admin jobs. So I've heard that it's not that easy, and I've also heard that GPST who get to the first rotation in GP, most of the time they work overtime, say they have finished 5 o'clock, but they cannot finish their workloads. They have to stay overtime. That's what I have heard, but I haven't yet worked in GP rotation, so I don't know. Apart from that, my struggles in starting in GP training, I would say portfolio. I think we have to maintain a portfolio throughout the training program. There are some portfolio requirements as well. You have to do the portfolio entry. Although I worked in a task gate before that for an year, but I was pretty much lazy to work on my portfolio. So my portfolio is completely empty. I would say this is my first time I'm doing something on my portfolio. So how to do it, how to navigate that, and how to ask the seniors to like sign your portfolio, sign your CBDs. Those something you have to learn. Yeah. Apart from that, I knew the system, so that is the plus point for me. I knew how to deal with the staffs and how the NHS works. So yeah, that was not an issue, but definitely who starts working in NHS as the first training job as Asivaya definitely is very challenging time because you have to do everything new. The system is new. You have to in the meantime you have to do your portfolio. You come to know how the rota works. So yeah, but that was a benefit for me because I knew how these things works. But doing the portfolio was challenging, I would say. And also, I didn't work in wards in NHS before, so I'm currently in geriatrics. So this is a ward-based system. I only work in accident and emergency, so that is not a ward. That is just an emergency department. But this geriatrics is a ward-based system. So I asked for shadowing like for a week because I told them that I only work in accident and emergency. I didn't work in any of the ward in NHS. So I might be okay, but just I asked for a week of shadowing that they allowed me to do that. And also my clinical supervisors and all the consultants were pretty much supportive about it. Yeah, so I overcame that. So I feel I'm okay now. Yeah.
Which rotation are you in now?
I'm currently in geriatrics.
Geriatrics rotation.
Yeah.
Okay, and you started working your portfolio also. You have mentioned.
Yeah, I am doing my portfolio. So I'm doing it since the end of last month because I think we have to do 18 case-based entry. We have to do no, sorry, 18 clinical case reviews. We have to keep entries for 18 cases, and then two case-based discussion with one of the consultants or one of the anyone above ST4 level. So there are some requirements. We have to meet the requirements within this next 6 months. So within the first 6 months of your rotation, and then next 6 months will be my GP rotation starting from February. So over that 6 months, I have to do another 18 case review, another two case-based discussions. So yeah, I'm working on that.
It will be pretty tough, I think. So, what's your top tip for keeping the portfolio manageable? And what's one capability or area, and you
I
often struggle
think
to evidence effectively.
yeah. So I think my first priority was to keep on track with the portfolio because I have got some colleagues who are struggling. They're saying that, oh no, I haven't done anything on my portfolio. I have got only 2 months left. I was like, why didn't you start in the beginning? So if you start, yeah, I understand like shifting is tough. Like as Vaya said, Vaya's struggling in the beginning. So you might like spend 2 months in adjusting. That's pretty natural. Everybody does that. But by the start of 3 month, third month, I think people should start working on portfolio because you only need 18 cases for the portfolio and two CBDs that you can get. So if you do like at least two cases every week, so I think 3 months is enough for
And
working on
what
the
you
portfolio.
are reviewing your patients and you are getting your patients, so you can also do that from.
Yeah, so we as a in the geriatrics as a
Yeah.
GPST1, we work in a frailty assessment beds. So that's the we receive the patients that are referred from the emergency or referred from GP. So we do everything, we assess and manage the patients independently. And then we discuss with the consultant or the consultant review the patients again and then change the management plan if needed or add something if needed. So that's what I put in my portfolio so that say I clocked a patient with confusion, I did this, and then my consultant did add this. So that's the clinical case. It might be different for different specialty, but yeah, the pattern would be the same. So
So yeah.
yeah, in that way, I think I'm in track with my portfolio. So I should be able to
Mm,
complete every other requirements within 6 months. Yeah, but the way is just if spend first 2 months in adjusting, okay, but start working on portfolio by the time you are adjusted to the specialty. Target to put at least 2 to 3 cases every week. You will get like I think some what is called self development time, 4 hours self development time every week. Use that
mm,
time. People
mm,
sometimes like do not use it and start panicking at the end. So I would say use that time because you have holidays, you have weekends, you have bank holiday leaves. So
mm,
you have some time to relax as well, but use the same development time. So by that way, you would not panic at the end that you haven't worked anything on your portfolio. I would suggest
mm.
that. Yeah,
And so you are managing it quite well, I can
I think so.
assume. Yeah, that's great.
Yeah,
And the MRCGP exam, right?
yeah, yeah,
So it involves both AKT and SCA,
yeah, yeah.
and you are preparing your portfolio. So, what are the requirements to sit in the MRCGP exam? Can you enlighten us? And how did you preparing or planning to attend in the MRCGP exam, and what to do with your portfolio, and what are the must-to-do resources or study patterns if you have considered it?
Yeah. So the requirement for sitting MRCGP AKT is you have to be a ST2. I
Hmm.
cannot do the MRCGP AKT as ST1. So I
Hmm.
haven't yet done anything about it because I only know that I will not be able to sit for the exam before August next year. So
Yeah.
I am currently,
So it's a
I do
practical
not,
thing to do, no
yeah,
problem.
yeah, I'm at the moment, I'm just working on my portfolio and thinking about doing driving because I don't drive. So I would say driving is really necessary as a GP trainee because kind of I'm in hospital rotation. I don't need to do home
Hmm.
visits or anything. So I
Hmm.
can manage that. But by the time in February, I'll be in GP rotation. My GP rotation is like not in walking distance from my home, not even in bus distance. So I have to
Hmm.
use public transport like train. If I would
Hmm.
drive, I would be able to drive
Hmm.
there for like 15 minutes. So
Hmm.
I think that's must as a GPST1
Hmm.
before you start the GP rotation. So I'm currently working on that. And I didn't do anything, to be honest, regarding MRCGP AKT because I know that I'll not be able to sit for this exam in this year. It will be in 2026, after 2026 August, if I
Hmm.
pass the all the requirements for getting into ST2. So
And you complete your portfolio first.
I'm
Yeah.
doing it, yeah. So I have to do that, and then at the end of the ST1 year, there will be a ARCP assessment.
Hmm.
So you have to pass the assessment to get into the ST2. So I
Hmm.
haven't done anything about MRCGP. That's the honest answer.
You have done pretty enough planning, so don't
Yeah,
worry.
yeah.
Yeah. So coming back to Aseer, the same questions. What are you doing about your portfolio, or what you're planning to do, and what about your thought on MRCGP exam? You have already a
Sorry,
specific two
uh,
parts.
if I may like interrupt the flow.
Yeah.
There are a few questions in the chat. I think it would be better if we answered them
Okay.
first.
Answer them first. Okay, let's go
Well,
for it.
someone asked Promi that didn't you use past medicine? And I have answered
No,
this already, I think.
yeah.
So yeah, Promi did
Mm,
not use past medicine, and I have used
mm.
past medicine a lot. So
Okay,
I think
yeah.
that answers
I
the
think
question.
that was clear. Yeah.
So the next
And
question was
then?
directed at me. So what were the
Mm,
pre-employment hurdles? Why did I join late? So the thing was,
mm,
actually I from the very beginning I was lagging
mm,
behind from my peers because I accepted the offer on the last day with just 30 minutes prior to the deadline. Why? Because I
mm,
was in the waiting list for psychiatry and I was considering whether should I venture for psychiatry because well, basically, I didn't have idea. I heard from others that psychiatry is very relaxed and there is a good, predictable progression pathway. So many things
mm,
in favor of psychiatry. But the thing is, my mark was not as high that I could be confident enough that I would be securing in a good training place, whether if I secure
mm,
it at all. So that's why I was considering. And another thing, I was also thinking that whether I should try for paces. So anyway, I opted for the GP training because I got a favorable place. That's the main reason actually. So, but so there was a 3 week window, and my journey started late. Then what starts the process is called onboarding. So before onboarding, there is a reference check. My reference check took about 2 weeks because the referees which who I mentioned in the ORL were not like do not respond to emails. That's why it took about 2 weeks. I had to go physically to every referee and then go. Sorry, no, not everyone.
You are
One of
lucky to be there than in Bangladesh because if you were here, you can't go them to physically
yeah,
to
exactly. So I would have to send someone. So
right.
as I said, we are cockroaches. So we'd figure out a way. That's not something impossible, but that makes the task
Yeah.
difficult. That's the
Yeah.
problem. So so I did have to go physically to my the referrer. So anyone who we have a tendency to use referees who are like very senior professors, but those are the people who you should avoid because your referee needs to respond to emails. That's the most
Hmm.
important thing for a referee. So
Yeah.
I was lagging more than a month behind when my onboarding started. So then I was late because I'm not good at organizing stuff and planning ahead. I would not say that. So some fault was from my side as well, and there are certain separate bodies who are responsible for separate tasks of onboarding with whom you need to be in touch separately. But I responded to some email, then I was being confused that I have already responded, given the same response to someone, why someone else is asking the same thing. And
Hmm.
they were well, very confusing. Basically, I found the onboarding process very confusing, and then I applied for visa late because my police clearance was initially rejected because I did not get the documents attested. I mean, every sort of stupid obstacle that you can have to go through. I have been through
Hmm.
all of them, I would say. So
Hmm.
my police clearance took about a month. So and then the visa application and everything. And I got visa late because my police clearance was late, and that was late because my onboarding process I started late with everything. I came late, but still I didn't know that for DBS I'll have to call them and then I'll have to set an appointment myself. I didn't somehow it missed because in the email there was a very short line. And also you need to have a two photographic IDs, and for that normally that's your passport and driving license. But before coming, somehow I missed my passport. Sorry, no, not passport. Without passport, I can't come, obviously. So my driving license. So I did not have two photographic IDs. So I had to send that to, bring that from Bangladesh through DHL. And I mean, I said every sort of stupidity that one can do, I did. So that's something you should not worry about. Uh, you should not. Everyone manages to do that. I was an exception. That's why I joined late. My DBS was not cleared in time, and by the time I did submit everything, I did submit my application within 1 week of the deadline. I mean, 1 week of my start date. But by that time it was August, and uh, anyone who is coming to the UK from overseas must know that August is the month when half of the UK sleeps because there everyone is on annual leave. So that's the time when the
Hmm.
schools are off for
Hmm.
1.5
Hmm.
months. So everyone goes on annual leaves by that time, and when someone goes to annual leave, their days basically stops. I mean, at a
Hmm.
standstill and freezes.
Hmm.
But I'm not sure if I can emphasize this enough. So before August, you need to get your job done because the HR manager who was responsible for my application went on annual leave for 2 weeks, and I had to do nothing. I was doing nothing. I was just waiting for her to come back and approve my whatever formality was left. So that was really stupid. But anyone who's coming, following my footsteps, by this time I think they would know not to repeat those mistakes, because if you communicate with someone who is in the UK, they will inform you of the importance of this. So, and another thing, how long you used the shadow period. So for me, it was 2
7
weeks.
days, 2 weeks.
2 weeks. So after 2 weeks, I was given an option. Do you want to continue? So do you feel confident? I said that I am still not confident enough for me to do the jobs independently, but I would like to try. So another option was extend it for 1 more week, but that would have been difficult. So for that they would need to involve the director of medical education for that. A director of medical education was already involved by that time, and he also gave me another option to change my rotation. If I felt that I'm not confident to carry on in psychiatry, then they can refer me to my training program director from GP, and I can go to a GP clinic or any other specialty that I liked. So there are, I mean, too much flexibilities, I would say. But what I said was I'd like to try, and I'll let you know in 1 week if I am confident enough. So I took a leeway of actually not 1 week, 2 more weeks. So overall, I had a 1 month of grace period overall, review period, probation, whatever you say, call it. So, but by that time I managed fine. So, but some warning I would like to give anyone who is choosing old age psychiatry. This is really slow psychiatry. So I felt that there were not any patients for me. So there were no new patients admitted. All the beds were full. So basically the patients are waiting to be discharged. And this discharge takes about 1 month, because at first they have to figure out what care home or where to send the patients to, and then the social worker has to come in, and they have to deal how the funding will be divided. NHS bears a part, council bears a part. So basically at that time the doctor has nothing to do. Only if a patient falls down, they will go, or the patient has itching, then you'll have to go and prescribe antihistamine and stuff. So old age psychiatry is some sort of, it has some advantages. It's slow, so you have more time to adjust, and sometimes, but you have difficulty learning because there is nothing going on. Sometimes, not always. So the question was regarding shadowing. So I sought the extension of 2 weeks of like probation, like when I'm working, but I'd say that I'd like to leave that option open, like changing my rotation or asking for further shadowing. But I didn't require that. But I told them that there is nothing going on in the ward. How can I give you a feedback that if I'm ready or not? So then by that 2 weeks, when a few patients were discharged, the ward was lively again. So currently in the last 1 week, we had so much to do in the ward because there were new admissions. So basically, managed fine. And to answer the question, it's up to you, your clinical supervisor, your educational supervisor, your TPD, training program director, even whoever needs involved. So there is a huge structure of support,
And I think
a
you got
hierarchy.
lucky, starting late and asking for shadow training and getting it. You are lucky, I think. Not everyone is going to get it. So you
Well,
should be
I
mentally
would like to
prepared.
I would like to disagree, because this is the job description of these people to cater to the needs of someone who's asking for the support.
Okay,
So
so there should be
rather,
a positive about that.
yes, exactly. But what the thing is, if I had known about this, I would start even before starting my training. So you can do that as well.
Okay.
So I know someone else who came from Bangladesh, who actually
Hmm.
did start shadowing even before the training started, because he communicated
He knew
with whoever
this.
needs to be communicated
Yeah.
with, and he started shadowing. But
So I'll
so
ask
for
Promi
me,
about that then.
yeah, for
Yeah.
me, but I was at
Hmm.
least paid for the shadow period. He was not, so I'm in an
Oh,
advantage in this.
yeah.
Sorry.
And can I
Yes.
ask Promi about that? That you have got this thing easy, I think, because you started your job as a trust gate, so you have your reference done, your DBS check done, and you don't have to repeat this when you enter the training. And how was the journey to it? Can you enlighten us?
I would say it was pretty straightforward because I my occupational health check, I didn't need to do anything because I just
Yes.
need to ask my previous trust to send the paper, my health check paper to my current trust. That
And
was
DBS
done.
certificate was also ready.
Also
Yeah.
done. Yeah. Only thing was
Mm.
reference. I put my previous job's clinical supervisor as my referee. He was a bit, he did it, but I needed to ask him again and again and again. So he did it on the like very last
From
day.
Bangladesh or from UK,
From
actually?
UK, from UK, yeah.
From
But he did
UK.
it.
So,
Yeah, he was a nice person. He was very very supportive, but I think he was very busy.
mm,
Definitely, the consultants are busy. But that was my
yeah, yeah.
mistake. I put as
But
a
they
consultant as a referee.
go through the email, I think, at
Yeah,
least
yeah,
here.
they did
Yeah,
it.
they
He
go
was
through. Yeah.
yeah, and he liked me very much. He was very happy with me. So I thought, yeah, why not him? So I put him, but I think he was very busy, so he didn't have much time. And then by the time the referencing end date was approaching, I was
Mm.
panicking. Oh my God, he's not doing anything. What shall I do? I even once changed him to another referee. I talked to another registrar, like, see, he's not doing that. Do you want? Are you happy to do that? He said, yeah, 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 do it, change me. And then by the date I changed it, he emailed me, I cannot open the reference link. Can you resend the link? I was like, oh my God. Then I resent the link to him, and then he did it on the like 2 to 3 days before the end date.
So you
So
got right response, I think.
yeah, yeah, I got it. But yeah, but I
Uh,
would suggest whoever is working here planning to enter into the training, do it wisely. Doesn't need to be a consultant. It can be any of the registrar. So I think do it like
who
choose
is
your
more
referee wisely.
approachable? So do if
My consultant was very approachable. He was very nice person, but I think he was busy. That's all.
so
Yeah,
you can choose less busy option. That is
yeah. I would
good.
suggest
Yeah.
that. Yeah. Apart from that,
Uh,
another
hmm,
hassle was I needed to shift from I think from south area of the UK to the north part
hmm,
of the UK.
hmm,
So I needed to pack everything. I don't drive, so as I said, I needed to pack everything and then needed to travel
hmm,
here. So that was a,
hmm.
but that is nothing as compared to what else you have
Hmm.
faced. Yeah.
Yeah, that's great. And coming back to Aseer, how is you preparing your portfolio and what is your plan about MRCGP as you have already passed MRCP two parts? So what
Sorry, my
are your
earlier
plans?
you asked this question, but I responded with
No,
something else.
no
And
problem.
this time I will do the same because there is another
Hmm.
question for me. So someone asked
Hmm.
that physically I went to referees, so can I please
Hmm.
enlighten others about what are the questions?
Okay, okay,
So
you
that's
can, you
one
can.
thing I would like
Hmm.
to enlighten you with. You don't need to worry about the
Hmm.
answers to the questions. There's are like
Hmm.
really simple ones. Is he
Hmm.
good? Is he honest, etc.? Is he or she? So
Hmm.
basically, that's nothing you should worry about. What you worry about is
Hmm.
responding to the email, someone who's
Hmm.
getting that. And
Okay.
so basically, that's it. So try to find someone who's a junior one and would like
Hmm.
whom you can call directly. You don't have to
Hmm.
physically go. You have to don't
Hmm.
have, need to worry that some professor. How am I going to call? So I'll have to go. So don't do that.
Hmm.
And I don't even remember. They were so insignificant. But the referees, regarding referees, it's very important to read actually what they're asking for. So if they're asking for a
Hmm.
consultant, you'll have to give a consultant. If they're asking for someone, some colleague, they will mention what level. If they're not
Hmm.
going, try not to go higher than a registrar and
Hmm.
someone who would respond. And basically that's it. So and whether you directly worked with him or you directly did not, even
Hmm.
my onboarding was delayed for a
Hmm.
further referencing check, which was like
Hmm.
they asked. So there was a gap of employment, and during that time you cannot give a doctor as your referee. You will need to choose someone else, lawyer, banker. There is a list. So I submitted the name of someone who works at a bank. So they I did not clarify that this person works at a bank because I thought it was really obvious that this guy, the designation I wrote, it was someone from a bank. So what they did was they sent a doctor form addressed to a doctor, and then did not respond. And then I emailed them twice that please change the reference form because this guy is not a doctor. This is a character reference. But they did not see the email because they are automated. There are so many things basically. I mean, went wrong when I was doing my onboarding. So coming back, so basically in one word, you don't need to worry about the questions themselves. You need to worry about the person and who they are asking for. Don't go for someone senior. They don't care if someone is like the health minister. They don't care. Just the person needs to meet the criteria. That's it.
mm, mm,
So regarding portfolio, that's something that I am very much struggling with still. So the
mm,
thing is, even for that, I did ask for support. So
mm,
I said that this portfolio, these things, I'm not familiar with how to write. I find it difficult to do it online, and even
mm,
I cited multiple reasons, and I was offered help in that arena as well. So they have given assigned a particular mentor who is a GPST two. By this time, he's a I think, GPST. I'm not sure, 2 or 3. So they
mm,
have assigned a mentor who to guide me with my portfolio, how to do stuff. So and I actually was late because I initially my I started joined late. Then I needed to understand the task itself, and portfolio. I was considering that it was not as important as my job in the word, which I was wrong in assuming, because for a trainee, whatever matters most is the portfolio. To be honest, so you have to keep your portfolio uh, up to date, and you can actually you do have a luxury to sit on it for 1 or 2 months max. But so for me, my entire duration of work has been about less than 3 months, or around 3 months, I'm not sure. September, October, yeah, 2.5 months. So so as promise said, that in the 2 months you don't have to worry about portfolio. I didn't. So I have, in the last 1 week I started. So I'm still lagging behind, but I'm hopeful that I would be able to manage the minimum in this rotation, and from the next I will have to compensate for that, doing
mm,
extra. But
mm,
I like to stay confident, so
mm.
I'm hoping that I'd be able to manage by that time.
And about the
Because
MRCGP, what is your plan then?
MRCGP I'm not worried about, because Promi, someone as organized as her, and someone who's
But
up to date with portfolio.
you have to apply some at some point.
I
Yeah,
need to
because
survive, right? But before that, one problem at a time. So initially,
okay.
my problem was starting work. Managed. Then was getting
Mm,
to understand the specialty. I did manage. Then doing some work,
mhm,
proper work, I did manage. And
mm,
now I'm worrying about my portfolio. And next, I will have to
mm.
worry about my clinical supervisor report, and then interim
Okay.
educational supervisor report. Then comes the
Mm,
ARCP, and after that, there are so many things to do because I still do not understand all the things. So, Promise said that we need 36 clinical case reviews, obviously, but that's not all, because we need to cover certain areas. So, we need to that those 36 needs to meet certain criteria. That's the problem.
mm,
So it's not clear to me entirely. So I'm speaking to my mentor, but the problem here is being in the UK. So basically, if you don't know someone personally, by after 5 o'clock, they are like basically
mm.
not in this world. They are not going to
Okay.
respond to text messages or calls, anything. And
Okay.
that's a problem, because the GP,
Mm,
who's my GP mentor, he is now currently in a GP practice, and being in a GP practice means that you are busy all the time. You don't have time.
mm,
So that's basically already Promi mentioned.
mm.
So I'm working with my GP mentor. I'm
Mm.
hopeful that I'll be able to manage, but by this
Yeah,
time I'm
I
still
think
there is a long way
I
to go.
think no
Thank you.
problem with that,
Sorry,
and
I
you will
didn't
crack
answer the
it.
question.
Don't worry.
I don't think
No,
I
no
added much
problem.
value.
No, no. Every word you are sharing
Thank
has
you, thank you.
definitely
Okay,
value.
let's
No
go.
problem with that. So I think your non-clinical single piece of advice, that one thing at a time, right?
Yeah. Basically, that's something I believe that's how
Mhm.
the UK operates. So they
Yeah.
won't. So
Mm,
for a whole day, if you
mm,
just sit on, like
mm,
you are busy with one single patient, they
mm,
will not worry, I would say. But they want you to make progress, and
mm,
I mean, one by one, they would like you to show progress. So I am now. I'm actually be in touch with my supervisors, and I'm saying that okay, this one, and next I'll do this, next I'll do this and that. So basically,
That
I'm
is good.
like I'm uh, crossing one obstacle at a time, but I'm
And you will
getting there.
manage it all. Don't
I'm getting
worry.
there.
I
Yeah,
know. Yeah,
I'm still not that behind, but
yeah, you're
yeah,
not.
there is a predictable pathway and a good support system which I like to take advantage of, and I'm hopeful
Yeah,
and
you'll
confident
certainly.
that I'll be. Yeah, thank you. Sorry.
Okay, and the last question to Promi. Okay, we are closing. Actually, we are at the end. So, if you have to give any last piece of advice, like Aseer said, one thing at a time, and if you have to give one particular suggestion who are planning to go for this MSR exam, or what you have gone through, if you have any experience, can you tell us? And on any advice or anything to know?
Yeah, so I think there are people who are struggling to get a trusted jobs, keeping applying,
Mm,
sitting back home with James registration, getting
mm,
frustrated with rejection
mm,
emails. So I would
mm.
suggest to the GP training is just 3 years training program, and if you don't like it, there is always way you can shift. But I would suggest you can try, and because you
Yeah.
just need a crest form and 2 years post graduation experience. That's the requirement for sitting the MSRF exam. So you can
That's
try.
a very
You have,
intelligent thing to say. Yeah.
yeah, you have got the opportunity. So why not try? That's what I
And
would suggest. Yeah,
I think once you get into here, then you can
yeah,
choose
yeah,
another profession,
yeah.
another
You
subject.
can.
Yeah.
Yeah, you have always have the options open. And
Mm.
also, if you worry that, oh, I don't have any NHS experience, I might struggle. None of us have this. Even I, although worked in any, but that was not a
Mm.
word-based system. So word-based system in
So I
NHS is
have
very
one
new.
personal question, because I
Yeah,
don't know that
yeah.
like Asir, he has entered UK through this GP road. He
Mm-hmm.
doesn't like it. Okay, he
Mm-hmm.
doesn't want to
Yeah,
continue the GP training.
yeah.
So if he want to join any Trustgate job now, it will be easy for him because he's already in UK, or what would
I
it
think
be like?
I think
The
so
visa
because
and all.
yeah, in terms of visa, because he is currently in sponsorship, definitely, as I am also in sponsorship
Yes,
visa.
yes.
So it's
Hmm.
like
Suppose
we
you
have
are
got.
not liking it, you want to
Yeah,
discontinue the GP training, then what will be?
in that case, you have to apply for another jobs. So say
Hmm.
you have got a trusted job. Now
Hmm.
you have to get another sponsorship from that trust. You cannot
Yes,
discontinue here without getting the another sponsorship because
sponsor.
yeah,
Yes.
because if you discontinue from this job, your sponsorship will be cancelled the same day. So you will not
Okay,
be
so
able
it
to
would be the
change.
pretty same to come from another country or stay there. It will be pretty same in this case, right?
But only plus point would be you have got some NHS experience, so you can show in your CV that yes,
Yeah,
I
that
have
would
got
be
six
great.
months
Yeah.
paid NHS experience. That's all you can tell. Other than that, in terms of visa, it's same. Other than the people who
Okay.
have got ILR, the lucky people. Yeah,
Lucky people, yeah.
yeah, yeah.
So that is pretty it. And thank you so much, both of you. You have shared so many. I'm so grateful, and I think many of us will be benefited from this, right?
Well,
And
sorry,
it
sorry,
is,
sorry to interrupt. I would
mm,
like to
yeah, yeah, you can.
just 30 seconds. Whoever is
Okay, no
thinking that
problem.
you will enter with a training and then shift to a trust job, trust grade job,
Mm,
just forget
yeah.
it. I would
Promi already said it, but
strongly
in a good
recommend against.
way.
But just to emphasize, yeah. So
So
I was,
I think I said that in a way that there
Yes,
are
yeah,
people
yeah. It
sitting
was
there.
not
so
that
I would,
clear, but
yeah.
it was pretty.
But
Yeah.
I would suggest if you ask me what to do, what to prefer, shall I shift to my target job? I would suggest complete the training because it's 3 years. Why not get
Yes.
the CCT and then shift to other
Yes, and
specialty?
then you can do another
Yeah,
subject. Don't worry. You
yeah,
just
yeah,
complete these three
yeah,
years first, right?
yeah. It might be possible that at the end of ST3 year you were liking it, so complete it
Hmm.
first. Yeah.
And I think as a person like Aseer who have MRCP, you can go through the general
Definitely.
medicine also
Definitely, yeah, definitely.
after completing it.
He can
Yeah.
also, I think he can also reapply for like higher specialty training in medicine.
Yes.
So
Yeah.
their
Well,
options are open.
I think Aseer will do that. No
nah,
problem. He has
just the
two
thing,
parts of
just to
MRCP.
clarify one more thing. So let's say you are discontinuing training,
Hmm,
GP training to
hmm,
go to trust
hmm,
grade, you will need
hmm,
references. So when you are
hmm.
will be applying any trust grade job, they will ask for reference, and the reference will be from the people who you deserted at without
Hmm,
any prior notice or
hmm,
anything. So that's
hmm,
not there. There is no way, I would say, that you
hmm.
would survive quitting a GP training, because you will
Yeah.
not get good references, and if you don't get good references here, you're doomed in the
But
UK.
I
That's how
think
the system.
you can shift your training. That's what I know because I know some of my colleagues that have shifted their training in between GP training. But it's something like if you change your training, say you are in GP training and then next year you have applied for something else that you really like, you have got into that specialty. If you change your training, you will not be able to come back in GP training ever in your life. So that's
Yes.
what I
Yes.
know. You'll be able to shift
Once
your
you leave,
training
you'll
in
be
between.
for.
Yeah,
Yeah.
yeah,
No, that's sort of like amicable separation sort of thing. I'm saying
yeah.
that you are going to a trust grade job. When you're going to
Hmm.
when you're going for a training, basically the wiser thing to do is like let everyone know that I'm struggling in this specialty. I'm not being able to love it, or like
So I am going to a
basically,
different specialty. Yeah.
I'm in a loveless marriage and I'm going to enter
Hmm.
another one. So sort of
Yes.
thing.
And also,
So,
I don't
but
think
if
people
you
would
go for a
be.
trust grade job,
Yeah,
it's
I
like
don't think people would
it's
do it. Like
difficult to
people get into
it's
training
difficult
and
to
then
explain.
apply for trust get
So
while
by
in the
the time
Yes.
training.
when I came,
Yeah,
I just took this opportunity again to
Hmm.
clarify or emphasize, because when I
Hmm.
was coming, many people gave me
Hmm.
this idea that go stay for 6 months, then do some medicine and then shift to medicine, because you are from you are like
MRCP
you have
holder.
good
Yeah.
progress in medicine. So
Hmm.
I actually on the back of my mind I had this idea. I considered it, but when I came and got to understand how the system works, I just discarded the idea.
Forget about this.
So basically, forgot about this. Doesn't make
First
sense at this
complete
point.
the GP training, then you can do whatever you like. I think
and
that
also
would be
like while you
best.
are in the training, you have got 3 years.
Hmm.
Like you know that you have got 3 years. You don't need to worry
Yeah.
about visa or anything. But
Hmm.
if you shift to a task grade job while you are in training, say you have
Hmm.
managed somehow. The task grade jobs
Hmm.
are like contract based. You will have only 1 year contract. What will do
Yes.
after 1 year?
So what will you go for? Why will you go for that? Yeah, that
Yeah,
would be.
yeah.
Okay. So
Okay,
thank you
thank you.
so much, both of you. That is great. And you have shared some real practical experiences and knowledge. I think whoever will listen to this, they will get benefited through it. I am also actually get to know a lot of things because I didn't know it. Yeah. So thank you so much to both of you. I have enjoyed every moment talking with you. I really enjoyed. Yeah. So thank you, Promi, and thank you, Aseer. We'll meet you
Thank you
soon.
very much,
Okay?
Ifatapu.
Thank you.
Thank
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 you.
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 Yeah.
Bye
Privileged
bye.
and flattered as well.
Thank you.
Okay.
Bye bye.
Okay. Bye. I'm leaving.
Bye.
Yeah.
Assalamu
Bye.
alaikum.